The Plastic Surgery Educational Network is here at the American Association for Hand Surgery, the American Society of Peripheral-Nerve, and the American Society of Reconstructive Microsurgery meeting. It's the annual meeting, and it's a coalition of some of the top reconstructive surgeons around the world. It's the highlight of the year for many of the reconstructive surgeons because the latest in technology, the latest in surgical techniques, and the latest in camaraderie is highlighted at this meeting.
This year I had the fortune of being the program chair for the American Association for Hand Surgery. And the exciting part was getting together a program with a mix of panel discussions with leading experts from this country and from overseas, and debates. Debates were great fun because we took some controversial topics like, do these practice guidelines really help you, or are they an ammunition for lawyers to sue you? And then we had free papers, and one of the new things we did this year was we had 2-minute free paper sessions where folks could come and share a quick idea, a thought, or a short pilot study, and that gave the membership an opportunity to present their work, even though it may not be a large project.
I really loved your talk, and I was wondering if you could talk a little bit about what you shared with us today about innovation.
The title of my talk was A Path to Innovation. When you go from the old way to the new way, there's a whole bunch of debate, conflict, almost aggressive attacks.
Right.
So as you start to see at panels or discussions in the audience where there's conflict, that means sit up straight. People are talking about a new paradigm.
And something's going to change.
And something's going to change. And there's always resistance to change. I mean, people just don't like change.
We just completed a panel on the best way to train microsurgeons in the next generation. And it was well attended, standing room only, and we had an all-star cast of senior microsurgeons giving their perspective on how to best train in the future.
My particular presentation compared the microsurgery training in different countries of the world. The programs that trained the residents best were those who offered a lab course with rats. They also had a high volume of replants where the residents could learn on very small vessels. And thirdly, they had a large clinical volume.
My focus of the presentation was to talk about how, as a young program and as a young program director, the unique challenges that we've had in establishing a large-scale microsurgery program in a very short time frame.
Another area that I addressed during this meeting is the treatment of the failed carpal tunnel. We ran an instructional course on this, dealing with how we now approach the use of wrapping, be they artificial, such as conduits or veins, to address recurrent perineural fibrosis around the common surgery of a carpal tunnel. While 90% plus work out just well, there's some that clearly don't, and how we treat that difficult problem.
I'm privileged to be the scientific program chair for this year's ASRM here in Red Rock, Las Vegas. It's been the best and most well-attended meeting in our history. We've had the most abstracts, the most registrants, the most dynamic panels. We have a panel that I really look forward to. If I knew then what I know now, and it's a panel of experts, household names in reconstructive microsurgery, sharing their wisdom. So it's a really nice compendium looking back and drawing on our history and looking forward to our future as to where we're going to go and how to shape our future for our society.
We had a panel this morning on the first combined day of the meeting where we compared nerve transfers together with hand replantations and together with robotics, and which one of those three modalities of reconstruction is really going to be the one of the future. And it turns out there'll probably be a combination of all of them. And I think it was very informative to the audience.
This meeting is particularly unique in that we spent one day called Specialty Day featuring integrated discussions, panels, workshops related to both surgery of the hand and hand therapy.
One of the focuses of this meeting was creativity and innovation in reconstructive surgery. Many things are different now from what we used to do surgically a number of years ago. Composite tissue allotransplantation is highlighted on a panel, an instructional course. Targeted muscle reinnervation is also highlighted. These are new surgical techniques to improve function. Hand transplants, face transplants will be highlighted in panels and lectures and guest speakers. So the real focus of this meeting is to bring out the innovative new features of what we do in surgery and reconstructive surgery, but also discuss where we see the future is going to be in all aspects, hand surgery, peripheral nerve, and microsurgery.
ASPS is just thrilled with what PSEN has already been able to accomplish in less than a year, and we of course could not possibly populate PSEN with all of the great educational content that we are providing without the contributions of the reconstructive societies, and this meeting will be an opportunity for us to get more of that. It's been a great partnership. Our sister societies do such incredible work, and I, as a member sitting in the audience, am getting incredible educational content myself, and I'm thrilled that we're able to bring it to our members.